when we look at the phenomenon that's called, long COVID or post-COVID symptoms, recent studies are showing that, it was thought that people who had, more severe symptoms were more likely to experience post-COVID symptoms. But we're finding that it doesn't matter if you had mild, moderate symptoms or severe symptoms. Even people who were asymptomatic during what we would call the acute phase can later develop symptoms. And those symptoms can range from fatigue. That's one of the most common symptoms, and post-exertional malaise or fatigue is very common. We see that in like 50 to 80% of people when you pretty much exert yourself and then you just feel like you're just totally drained and you can't function. And those symptoms can literally last for days after the physical activity. We see people who have chest pains, shortness of breath, body aches. They have brain fog. You just feel like you just can't function. You just can't do your regular routine. You can't get through a day at work. There are huge, any body system can be affected. So particularly mental health as well. We have people who are more depressed. They just don't feel like themselves. And it just lingers, beyond that 12-week period. They're depressed, they're anxious. They may even have PTSD from dealing with, the virus for so long. So this is a real phenomenon that people are seeing. And sometimes it may be not recognized by the doctors, or people can kind of blow it off as, oh, you're fine, or this is something that you had before, you'll get over it. But that's not the case. And people really need to know that if they've had COVID, if they've had family members with COVID, they need to make sure that they are being checked up, depending on, their medical history, what they have dealt with as far as COVID, how severe their symptoms were. They really need to follow up. In a lot of cases, they need to see a specialist. They may need to go to a post-COVID medical clinic that deals with people who are dealing with issues post-COVID. Because what we're seeing, unfortunately, we're seeing young people who are succumbing to post-COVID complications. And a lot of them are people of color because nobody is telling them to go see their doctor, or they're feeling like, oh, I'll get over this. Or they're just kind of being dismissed as, oh, that's your asthma, or this is something else that's your diabetes. Actually, no. Oh, you've had heart issues before, you'll be fine.